Good morning.
Good morning.
Is that your sheet with your signatures?
Yes, ma'am.
Okay. You'll get your supplies. Your patient's going to be over there
Okay.
at the end bed, and I'll be waiting for you over there.
Okay.
Hold on. Okay, do that again.
Knock, knock.
Come in.
Good morning.
Good morning.
My name is Megan. I am your practical nursing student from National Park College,
Hi, Megan.
and I'm going to be changing your dressing today.
Oh, okay.
Can you tell me your name and date of birth?
Jerry Smith. My birthday is 12/10/68.
Okay, Jerry. And do you have any allergies?
I'm allergic to penicillin.
Okay. Very good. So, can you tell me your pain on a scale of 1 to 10?
Oh, it might be a 2. They gave me some medicine a little while ago because they said you were going to come in here and do that dressing change.
Very good. Yes, sir. And sometimes when we do that dressing change, it can be a little painful, so we'd like for you to have some pain medicine on board.
Well, that's good.
I'm going to raise your bed up. Okay. All right, now do you have any questions regarding your dressing change before we get started?
Is this going to hurt?
It may be a little uncomfortable, but if it gets to a point that it's too uncomfortable or it really does start to hurt, be sure you let me know and we'll take a break.
Okay.
All right, so the first thing that we're going to do is get your dressing off.
Okay.
Okay. So this tape you may feel a little bit of tugging, but again, if it's too much, you be sure and let me know. Okay. I see some serosanguinous drainage, a moderate amount. Do you mind being my nurse to take
Sure.
this for me? Great.
So I'll write that down for you.
Okay, thank you. And there was no odor.
No odor, okay? Okay.
Alrighty. Okay. Now that we've got that dressing off, there's a few things I'm going to do. First, I'm going to measure your wound, and then I'm going to redress it so that it'll
Okay.
be nice and fresh.
Okay.
And I've used the foam tip applicator so that none of the fibers from a cotton tip gets in the wound, and it has the measuring there on it.
Okay.
So length is 10 centimeters.
Okay.
Width is 8 centimeters.
Okay.
There is a tunnel at 7 o'clock of 4 centimeters.
Okay.
There's undermining from 11 to 1 of 3 centimeters.
Okay.
I do notice there is some slough. I would say 40% of the wound, 10% bone. The rest is granulation, and then there's some slough there and some necrotic tissue right there.
Okay.
Okay. Okay, so I'm going to get my supplies ready. Now, because this bottle has been used, it's been opened, there is a date. The date and time are within 24 hours, so I know that it's okay to reuse it, but I do have to lip it. So I'm going to open it. And I was sure to keep my label towards my hand.
What's the purpose of lipping?
It allows for that top area of solution to go into the trash can so that you're not using it and possibly contaminating your dressing.
Okay.
I'm going to open these. And even though this is not a sterile procedure, we still want it to be as clean as possible. I'm going to pour my solution here because it is a wet to dry per the orders. Okay.
Why is it important to do hand hygiene after you remove the dirty dressing?
Because you don't want to have dirty hands. You want to keep them clean.
Okay.
Anytime you touch anything soiled, you always want to clean your hands again. Okay. Okay, so I've got a new foam tipped applicator because this one is dirty and I don't want to pack his wound with a dirty applicator. So I've got that. Now I want to wring this out. Even though it's a wet to dry, I don't want it sopping wet.
Why does that matter?
Because if your wound is too wet, it will cause maceration where it will actually soften that tissue and it won't heal correctly.
Okay. Very good.
Okay, so it's still damp, but I can't squeeze anything out of it. Okay, and then what I'm going to do, leave that there, is I'm going to fluff the 4x4 so that I have something to pack with. Okay, sir, you're going to probably feel some pressure as I start to pack your wound, but again, if you have any discomfort that's just unbearable, please let me know and we'll take a break, okay?
Okay.
All right, here we go. So I want to start first with my tunnels, and I want to pack them lightly as to not have it too tight so that the wound can't heal properly, but to have it tight enough so that there's no abscess created.
Okay.
And I'm careful to not touch the outer skin with my packing.
Why do we not touch the outer skin?
That would contaminate it.
Okay.
And even though it's not a sterile procedure, we don't want to bring any outside contaminants into the wound bed itself. Okay. Now I could have also packed it with rolled gauze, just really whichever.
The process is the same.
Yes, ma'am. Okay. Good.
Very good.
All right. So then I want to cover with a dry, because like I said, the order says wet to dry. So we'll cover with a dry 4x4. And then an ABD pad.
How do you know if the ABD pad is inside out or right side out versus the
It
other
has
way?
this blue line here
Yes.
that you want on the outside.
Okay, very good.
Okay, and then I'm going to tape it as a framing it, which just means to tape down each of the corners or each of the sides. I don't want it to be too long because then that just adds extra risk to the patient's skin that's not necessary. Okay, and then before I put this last piece on, I'm going to write my initials, the date, and the time. That way I'm not writing on the patient.
Okay.
And I don't want to write it on the dressing because then if he were to have any drainage, you may not be able to tell because of the writing. Okay, we're all finished. How are you?
Oh, that was not bad at all. Thank
Okay.
you so much.
Fantastic. Well, I'm going to lower your bed back down. Is there anything that I can get you before I leave the room?
I don't think so. I appreciate it.
Okay, well, I've got your call light right here at your bedside. So if you decide that you need anything, you just give me a call, okay?
All right. Thank you so much.
All right, thank you.